Hello everyone, and welcome back to our channel. Today, we are diving into a critical issue affecting millions of people in South Africa, the HIV epidemic. For the first time, the number of people living with HIV in the country has reached 8 million, a staggering 12.8% of the population. This milestone highlights both the progress made in combating the disease and the challenges that remain. So, let's break down what this means, why it's happening, and what can be done to turn things around. Currently, around 6.2 million South Africans living with HIV are receiving antiretroviral treatment, commonly known as ART. This treatment is vital because it helps suppress the virus, allowing people to live longer, healthier lives while reducing the risk of transmission. However, the concerning part is that approximately 1.8 million people are either not on treatment or unaware of their HIV status. This gap in treatment coverage is a major issue that needs urgent attention. One of the key reasons for the rise in HIV cases is that more people are being newly infected than those dying from the virus. Just in the 2023-2024 period, an estimated 178,000 new infections were recorded. Meanwhile, 105,000 people with HIV passed away, with 53,000 of those deaths being directly linked to HIV-related illnesses. Another 52,000 people with HIV died due to other causes. This means that despite the progress in treatment, the virus is still spreading at an alarming rate. Experts believe that one major factor contributing to the rise in new infections is the declining use of condoms. According to Dr. Lee Johnson from the University of Cape Town, condom usage has dropped, leading to an increase in HIV transmission. He pointed out that the latest estimates of new infections are slightly higher than those from last year's Tembisa reports, which track HIV trends in the country. This worrying trend suggests that awareness campaigns and preventative measures need to be reinforced. While South Africa has made incredible progress in making ART widely available, the country still falls short of international targets. Global health authorities, including UNAIDS, have set ambitious goals. 95% of people diagnosed with HIV should be on treatment, and those on treatment should achieve viral suppression. Right now, about 78% of South Africans living with HIV are on treatment, which is a good number but still not enough to meet these global targets. Another major issue is that many people only start treatment when their immune systems are already severely weakened. In the past year alone, around 54,000 adults began ART with dangerously low CD4 counts, below 200 cells per cubic millimeter. CD4 counts measure immune system strength, and anything below 200 is considered critically low. People who start treatment late often have worse long-term health outcomes, and they are at higher risk of developing serious complications. Adding to this challenge is the high number of people who discontinue treatment. In 2023-2024, an estimated 714,000 people restarted ART after stopping for at least a month. Of these individuals, nearly half had critically low CD4 counts when they resumed treatment. This cycle of starting and stopping ART is dangerous, as it increases the risk of drug resistance and poor health outcomes. The South African government is aware of these challenges and has launched the Close the Gap campaign. This ambitious initiative aims to put an additional 1.1 million people on treatment by the end of 2025. At the campaign's launch, Health Minister Aaron Motsoaledi made a bold statement: "We should not accept that AIDS is here forever. It is not. We want to end it. It's all in our hands and it depends on our will." Despite these efforts, there are concerns about funding. South Africa relies on international aid programs like PEPFAR to support its HIV response. However, with global funding cuts and shifting priorities, financial stability for HIV treatment programs remains uncertain. Right now, about 74% of South Africa's HIV response is funded by domestic resources, but losing international support could put millions of lives at risk. On a more positive note, life expectancy among people living with HIV has increased significantly thanks to effective art. When taken correctly, art can suppress the virus to undetectable levels. This means that people with suppressed viral loads have zero risk of transmitting HIV sexually and very minimal risk of mother-to-child transmission. This is a game-changer in the fight against the epidemic, proving that treatment not only saves lives but also prevents new infections. So, where do we go from here? To turn the tide, South Africa needs to continue expanding access to treatment, strengthen awareness campaigns, and encourage people to know their HIV status. Condom use must be promoted again, especially among young people, to prevent new infections. Additionally, policies must focus on ensuring that those who start out remain on treatment without interruptions. The battle against HIV is far from over, but with the right strategies, South Africa can still achieve its goal of ending AIDS as a public health threat. The key is collective action. Governments, healthcare providers, civil society, and individuals must work together to close the treatment gap and prevent further infections. What do you think about these latest developments? Should the government do more to encourage HIV testing and treatment? Let us know your thoughts in the comments below. Don't forget to like this video, subscribe to our channel for more in-depth discussions on important issues,